Radiation therapy on the magnetic resonance linear accelerator, also called MR-Linac. In this video, you will learn what is the MR-Linac, how you will get your treatment, and what to expect at your appointments. This video includes comments from a patient who had treatment with the MR-Linac. The patient will also show you what to expect when you get treatment with the MR-Linac. What is the MR-Linac? Your radiation oncologist, also called your cancer doctor, may recommend you get radiation therapy on a machine called the Magnetic Resonance Linear Accelerator, or MR-Linac for short. The MR-Linac is a machine that combines radiation therapy with a magnetic resonance imaging scanner, or MRI. Radiation therapy uses high doses of radiation to destroy tumors. An MRI uses a magnet to take detailed images of the inside of your body. With the MR-Linac, your treatment team can take MRI images and see them during your radiation treatment. Normally, an MRI is not done at the same time as you get radiation. But with the MR-Linac, the team can see any changes to your tumor right away. For example, if the tumor has moved slightly. The team can then adjust and direct the radiation beam in a highly precise way. Being able to adjust and target treatment may improve your outcomes and reduce side effects. Side effects from radiation are caused by damage to healthy tissue. With the MR-Linac, the radiation is highly targeted to the tumor, so there is less damage to healthy tissue. How you will get your treatment with the MR-Linac. Before you start your treatment, you will meet with a radiation therapist. Radiation therapists are part of your treatment team and work with your oncologist to create your treatment plan. They will also give you your radiation treatment. The radiation therapist will tell you if you need to prepare for your appointments. Whether you need to prepare depends on what area is being treated. You may need to follow a special diet, drink a certain amount of water, or learn to use a device that reduces the amount your body moves when you are inside the MR-Linac machine. Your first appointment will be the simulation appointment. The simulation appointment will be similar to your treatment appointments, but without radiation. You will be inside the MR-Linac machine for 30 to 60 minutes. Your treatment team will take MRI images of the tumor. Your team uses the MRI images and advanced software to create a treatment plan tailored to you. This treatment plan will include the amount of radiation you get, the precise location of where the radiation will be aimed, the number of treatment sessions you need, and how often you will get radiation, for example, every day or every 2 days. Once the team creates your treatment plan, you will have your radiation treatment appointments. At each treatment appointment, you will be inside the MR-Linac machine between 60 to 90 minutes based on your treatment plan. The MRI will take images of the tumor and the tissue around it. The team will compare these images with the images done at your simulation appointment. Your team looks to see if there were changes to your tumor. For example, if the tumor changed in size, shape, or location. Based on these changes, the team will adjust and direct the radiation to your tumor. This was an overview of how you will get your treatment with the MR-Linac. The next part will focus on what to expect at your MR-Linac appointments. This part of the video will include comments from a patient who had treatment with the MR-Linac and wanted to share his experience with you.
My first visit, I was somewhat apprehensive, but the staff initially started off really paying attention to me and made me feel comfortable. How professional that they were, how detailed that they were, and the empathy that they projected. All of it in a nutshell was very satisfying and did ease any anxiety that I might have had. By the third time, I felt part of the team. And I love that because I played on team sports. And I know everybody's important. And I felt that they were happy the way things were going with me. So it became a bit of fun, besides saving my life.
Each time before you enter the MR-Linac area, the radiation therapist will ask you to fill out a safety questionnaire. The MRI contains a magnet, and this magnet may damage some implanted devices, for example, a pacemaker. The radiation therapist will review the questionnaire with you to ensure it is safe for you to enter the room. You will also need to change into a gown and remove all jewelry. You can store all your items in a locker in the changing area. The radiation therapist will lead you to the MR-Linac area and position you on the MR-Linac bed. The position you will be in depends on the area being treated. The radiation therapist will give you a blanket to keep you warm. The magnet in the MR-Linac is loud, so the therapist will give you earplugs and headphones.
So the young lady had said to me, we're going to put these headphones on you and we're going to instruct you. And if you would like, we can play music. What kind of music would you like? And here's this 78-year-old saying, romantic music. And they giggled and laughed. I said, I'm not kidding you. That will make me feel comfortable.
You will continue to hear the whirring sounds of the machine during your appointment. This is perfectly normal. You will not see or feel the radiation. Recall, at each treatment appointment, you will be inside the MR-Linac machine between 60 and 90 minutes based on your treatment plan. To get the clearest images possible, patients must stay very still while on the bed. Moving will make the MRI images blurry. Some patients may feel discomfort from lying on their back for a long time. Others may feel anxious from the noise and the feeling of being confined. Tell the team if you feel discomfort or anxiety during this session. Your team can help you feel more comfortable and calm.
Now I had to work out how I was going to be handling inside the machine. There were a couple of ways I could do this. Number one was whoever is in the machine, you learn how to breathe properly. It really holds you in position. I felt very secure. The second part was my darling wife would say to me, when you're upset, go to your happy place. So I have two happy places. One is the beach that we go to every year, the ocean and the sand. The second is my golf experiences. If I could reminisce all the great shots that I made, if I could get my mind occupied, then I can contend with this machine.
The team will be in the control area where they will check on you at all times. You and the radiation therapist will be able to speak through a two-way intercom system.
Okay, we're ready to do the next scan.
You will also have a buzzer to hold and press if you need help.
Is everything okay?
Some patients may find having treatments with the MR-Linac to be a challenge. But getting your radiation treatment with the MR-Linac may improve your outcomes and reduce side effects. Tell your healthcare team if it is hard for you. Your team can help you find ways to make it easier or suggest other methods of getting your radiation treatment.